welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and here's what I bring to you all from the world of medicine. Walkable neighborhoods can lead to decreased cardiovascular risk. Neighborhood walkability, a measure of how easy and safe it is to walk to reach resources for daily living, such as a grocery store, pharmacy, school, work, and church, is associated with lower cardiovascular disease burden and risk, according to two preliminary studies to be presented at the American Heart Association's Scientific Sessions 2022. Cardiovascular disease is the number one cause of death in the US and globally, according to the American Heart Association's Heart Disease and Stroke Statistics 2022 update. A key component for achieving optimal cardiovascular health and reducing cardiovascular risk is physical ability. Research finds vaping to cause poor cardiovascular function even in young adults. Adults who regularly use electronic nicotine delivery services or e-cigarettes displayed worrisome changes in heart and blood vessel function and performed significantly worse on exercise stress testing than people who did not use any nicotine products, according to two separate analyses of preliminary research. The CLUE study was conducted by researchers at the University of Wisconsin between March 2019 to March 2022. It was designed to examine the short-term effects of vaping and cigarette smoking in regular nicotine users compared with similar matched peers who didn't use nicotine in any form. The study included 395 participants. Social vulnerabilities and cardiometabolic risk during pregnancy linked, according to research. Social vulnerabilities such as living in poverty, living in a single-parent household, not having a car, or being described as a minority were linked to increased cardiometabolic risk during pregnancy, according to preliminary research to be presented at the AHA Scientific Sessions 2022. The number of pregnancy-related deaths in the US has increased in recent years, and about one-third of these deaths are due to cardiovascular diseases, according to the CDC prevention. In this study, researchers explored the link between cardiometabolic factors and social vulnerabilities. Single dose of antibody drug prevents malaria infection in African adults. One dose of an antibody drug safely protected healthy non-pregnant adults from malaria infection during an intense 6-month malaria session in Mali, Africa, a National Institutes of Health clinical trial has found. The antibody was up to 88.2% effective at preventing infection over a 24-week period, demonstrating for the first time that a monoclonal antibody can prevent malaria infection in an endemic region. An estimated 241 million cases of malaria occurred worldwide in 2020, according to the WHO, resulting in an estimated 627,000 deaths, mostly in children in sub-Saharan Africa. The study team for the Phase 2 trial enrolled 369 healthy non-pregnant adults aged 18 to 55 years in the rural communities of Kalifabougou and Torodo in Mali, where intense P. falciparum transmission typically occurs from July through December each year. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.